Have you ever felt like there's always something stuck in your throat? No matter how often you swallow or clear it, the mucus just keeps coming back. Maybe it's worse in the morning, after meals, or when you lie down at night. Most people assume it's just a cold that never fully went away, but doctors say persistent mucus in the throat can be your body's way of telling you something important. While mucus itself is completely normal and actually protects your airways, producing too much of it, or constantly feeling it in your throat, is not something you should ignore. Surprisingly, the real reason often has nothing to do with your lungs. In fact, one of the most common causes starts in your nose, while another begins in your stomach. Today, we'll uncover the most common reasons why mucus keeps building up in your throat, explain why it happens, and reveal which warning signs deserve medical attention. Stay with us until the end, because the final cause is one that millions of people experience every day without realizing it's responsible. Mucus has a very important job. Your body naturally produces it to trap dust, bacteria, viruses, allergens, and other tiny particles before they reach your lungs. It also keeps the lining of your nose, throat, and airways moist and protected. Most of the time, you swallow mucus without even noticing it. But when your body starts producing more than normal, or when the mucus becomes thicker, you suddenly become very aware of it. That constant need to swallow, cough, or clear your throat can become frustrating and sometimes even embarrassing. Understanding why it's happening is the first step toward understanding what your body may be trying to communicate. The most common cause of persistent throat mucus is postnasal drip. This happens when excess mucus produced inside your nose slowly drips down the back of your throat instead of draining normally. You may not even notice a runny nose, but you constantly feel something sliding down your throat. This often causes frequent throat clearing, coughing, hoarseness, or the feeling that something is stuck there. Postnasal drip can occur because of allergies, sinus infections, seasonal changes, or even irritation from strong odors and pollution. Since the mucus continuously trickles into the throat, it creates the sensation that it never goes away. Another very common cause is allergies. Pollen, dust mites, mold, pet dander, and other allergens trigger the immune system to produce extra mucus as a defense mechanism. Unlike an infection, allergies usually don't cause fever, but they often bring sneezing, itchy eyes, nasal congestion, and persistent throat mucus. Some people only experience symptoms during certain seasons, while others struggle all year because of indoor allergens. Even mild allergies can keep the throat irritated for months if the trigger remains present. A third possible cause is acid reflux, especially a form called laryngopharyngeal reflux, often shortened to LPR. Many people think acid reflux always causes heartburn, but that's not always true. In LPR, stomach acid travels upward into the throat without causing the classic burning sensation in the chest. The acid irritates the delicate tissues of the throat, and the body responds by producing more mucus to protect itself. This often leads to chronic throat clearing, a hoarse voice, the sensation of a lump in the throat, or mucus that seems impossible to get rid of. Because there may be little or no heartburn, many people never suspect their stomach is the source of the problem. Sinus infections can also increase mucus production. When the sinuses become inflamed due to bacteria or viruses, thick mucus begins accumulating inside the sinus cavities. Instead of draining properly, it flows down the back of the throat. This often produces thick yellow or green mucus, facial pressure, headaches, nasal congestion, and a reduced sense of smell. Even after the infection improves, inflammation may linger, allowing excess mucus to continue draining into the throat for several weeks. Colds and viral infections are another frequent explanation. During an infection, your immune system increases mucus production to trap and remove viruses from your airways. Although most colds improve within a week or two, some people continue experiencing throat mucus for several weeks after other symptoms disappear. This lingering inflammation gradually settles down as the tissues heal. But during that period, frequent throat clearing may continue. Dry air may sound like an unusual cause, but it can have a surprisingly large effect. Heated indoor air during winter or constant exposure to air conditioning removes moisture from the nose and throat. In response, your body often produces thicker mucus to compensate for the dryness. Instead of flowing smoothly, the mucus becomes sticky and difficult to swallow. Many people notice their symptoms are worse first thing in the morning because they have been breathing dry air throughout the night. Dehydration has a similar effect. Water is essential for maintaining thin, healthy mucus. When the body lacks enough fluids, mucus becomes thicker and more difficult to clear. Even mild dehydration can leave the throat feeling coated or sticky. People who drink very little water throughout the day may notice they constantly need to clear their throat, especially after sleeping or spending time in hot weather. Smoking and exposure to cigarette smoke are major contributors to chronic throat mucus. Tobacco smoke irritates the lining of the airways, causing the body to produce additional mucus in an attempt to protect itself. Over time, smoking also damages the tiny hair-like structures called cilia that normally sweep mucus out of the respiratory tract. Once these cleaning mechanisms slow down, mucus remains trapped for longer periods, leading to chronic coughing and frequent throat clearing. Even secondhand smoke can irritate the airways enough to increase mucus production. Air pollution and environmental irritants can produce similar symptoms. Dust, chemical fumes, cleaning products, perfumes, and workplace exposures may continuously irritate the throat. Every time the tissues become irritated, the body responds by producing extra mucus as a protective barrier. If exposure continues every day, the mucus problem often continues as well. Asthma is another condition that can increase mucus production. Although asthma is commonly associated with wheezing and shortness of breath, some people experience a cough-dominant form where persistent throat clearing becomes one of the main symptoms. Inflammation inside the airways stimulates mucus production, and the throat may constantly feel coated even when breathing problems are mild. Certain medications may also contribute. Some blood pressure medications can trigger a chronic cough, while others may indirectly irritate the throat. Medications that dry out the mouth and throat can make mucus thicker and more noticeable. This doesn't mean people should stop taking prescribed medicines, but it explains why throat symptoms sometimes begin after starting a new medication. Chronic sinus inflammation, also called chronic sinusitis, deserves special attention because it may last for months. Unlike a temporary infection, chronic inflammation keeps mucus production elevated over a long period. The mucus may be thick, and many people constantly feel pressure around the eyes, cheeks, or forehead. Since the drainage continues day after day, it creates the impression that the throat is always full of mucus. Some people experience enlarged tonsils or irritation from frequent infections. Inflamed tonsils can trap mucus and bacteria, producing ongoing discomfort and repeated throat clearing. Although this is less common than postnasal drip or reflux, it can still contribute to persistent throat symptoms. There is also a condition known as globus sensation. People with globus often describe feeling as though something is stuck in their throat, even though there is no physical blockage. Stress, muscle tension, acid reflux, or mild throat irritation may all contribute. Because the sensation feels similar to mucus, many people repeatedly clear their throat, even when little mucus is actually present. Unfortunately, repeated throat clearing further irritates the throat, creating a cycle that becomes difficult to break. The color of mucus can sometimes provide clues. Clear mucus is usually associated with allergies, mild irritation, or normal mucus production. White mucus may become thicker because of congestion. Yellow or green mucus often appears during infections because immune cells have collected in the mucus, although color alone doesn't always prove a bacterial infection. Blood-streaked mucus occasionally occurs after severe coughing or irritation but should always be evaluated if it continues or appears repeatedly. Many people wonder why symptoms seem worse in the morning. During sleep, mucus naturally collects because swallowing becomes less frequent while lying down. If postnasal drip or reflux is present, the mucus has several hours to accumulate. That's why the first few minutes after waking often involve repeated swallowing, coughing, or clearing the throat before symptoms gradually improve. Another common question is why throat clearing never seems to solve the problem. Every time you clear your throat forcefully, the vocal cords briefly slam together. While this may temporarily remove some mucus, it also irritates the tissues. That irritation can actually stimulate the production of even more mucus, creating a frustrating cycle where throat clearing leads to additional throat clearing. Although persistent throat mucus is usually caused by conditions that can be managed, certain symptoms deserve prompt medical evaluation. Difficulty swallowing, coughing up significant amounts of blood, unexplained weight loss, severe shortness of breath, persistent chest pain, or symptoms lasting for many weeks despite treatment should never be ignored. These symptoms require a proper medical assessment because they may indicate a more serious underlying condition. The encouraging news is that in many cases, persistent throat mucus has an identifiable cause. Whether it's allergies, postnasal drip, acid reflux, sinus disease, smoking, dehydration, environmental irritants, asthma, or another condition, Understanding the underlying reason is the key to reducing symptoms. Rather than focusing only on the mucus itself, doctors look for the condition that's causing the body to produce it in the first place. The important thing to remember is that mucus isn't your enemy. It's one of your body's natural defense systems, constantly working to protect your airways from infection, irritation, and injury. When you notice persistent changes in the amount, thickness, or sensation of mucus, your body may simply be asking you to pay closer attention to what's happening inside. If you've been struggling with constant throat mucus, remember that you're far from alone. Millions of people experience this problem, and in most cases, the cause can be identified and managed with the right medical evaluation. Paying attention to your symptoms instead of simply accepting them as normal may help uncover an underlying condition that deserves treatment. If you found this video helpful, don't forget to like the video, subscribe to the channel, and turn on notifications so you never miss our latest health content. Share this video with your family and friends because understanding the common causes of persistent throat mucus could help someone recognize an important health condition sooner. Thank you for watching, and we'll see you in the next video.